Hello and welcome to another episode of Glam Up with Katrina. Well, today I have my very good friend and a dentist, Dr. Carla Cirino, and we are going to be talking about all things cosmetic dentistry. Now, Carla actually did my full smile makeover, and I can tell you it's one of the best cosmetic procedures I've ever had. So welcome, Dr. Carla.
Thank you so much, dear Katrina.
So listen, we would like to start by telling the audience how you got started in dentistry and what made you want to be a dentist.
Wow. Well, dentistry has been my family for many years. My father was a dentist.
I didn't know
Yes.
that. Okay.
And since I was a little girl, I watching him and I always be to be a dentist, When I was 4 or 5 years old, people ask me, the silly question, what do you want to be when you grow? Is dentist.
Amazing.
And this is my passion for 31 years.
Well, I can definitely say it is. I mean, something I have to tell you is that Dr. Carla is an absolute perfectionist. I mean, when she did my mouth, the final procedure came back, the teeth came back, and she was not happy with it. And she sent them back. She went down to the lab personally and told them exactly what to do. And I really have always respected you for that, because really you're a perfectionist. And I think in dentistry, there's no other way to be, right?
Exactly. You need to love what you do. You need to understand what you are doing. And every smile I do, it's a unique smile. You saw I took all the measure of your face, your teeth, everything to find the correct size for your face, the correct shape for your face. And this is personalized, this proper smile for each face.
Yeah. And I know that you spent a lot of time deciding on what length. I had veneers before and crowns, and they were much shorter and very masculine. And Dr. Carla made these teeth a lot more feminine, a little bit whiter and longer. I mean, she gave me a totally different look, and I could not be more happy with it. I mean, I think it's 2-3 years on, 2 years at least. Coming
4
up
years.
No. Is it really 4
I think
years?
it's 4 years.
Oh my goodness.
Yeah.
Okay, so I've got lots of questions for you. So how do you think cosmetic dentistry has evolved over the last 5 or 10 years?
Well, cosmetic dentistry always been is the part of the level in dentistry, yeah. But it's now, so many techniques, so many machines to working. Like I use laser, I use many DSDs, digital smiley design, everything to make it easier and less painful to the patient. And aesthetic dentistry is, well, in my point of view, our face, our smile is the picture and the face is the frame. Yeah. And so many people worry about to do a lot of things in the face, but forget about the teeth. The teeth can show everything and for me, of course, is your first impression. You come and you say, if you see a beautiful smile, these people remember you for a long time.
I think, for me, it definitely made me look younger, gave me more confidence. It even filled out my face a little bit because you made them bigger.
Exactly.
And I had two number twos, which the center line was off. And I know that was extremely challenging
the
for
middle line is very important, especially the upper one. You have a little bit swift, the middle line, and it looks when you have the large smile, you always have the middle line shifts, and then it's a little bit strange, and it's correct. The upper middle line is very important to have symmetry and the balance, the smiles. And correct bite is very important as well.
Yes. I want to go back for a minute, Carla, to the laser that you do, because so many people are terrified of going to the dentist. And I know that you
Right.
have pain-free solutions for that. Can you talk a little bit about that?
Yeah, the laser is amazing because before the laser, I always do gum smiley, for example, with the blade and the stitches, everything, it's not painful because it's under anesthesia, but it's post-operation is uncomfortable for longer. The laser, many times I do just put local anesthesia, just the creamy, and the laser cut, because I use the laser combined with water, is water laser, and cut the gum and it doesn't bleed. It's no don't have pain, don't have side effect. And after 2 days, the gum is completely healing. And more and more people now is don't feel more afraid to go to do the gum smile, or to cut the tongue tight or lip tight, and to do deep pocket clean, before you scrub. Does with the laser clean and help healing the bone, healing faster the gums. It's amazing.
Yeah, I mean, I must admit, I'm okay in the dentist, but I hate when you go for the scale and polish and you have that scraping, scraping, scraping. Just the noise, really, it's like chalk on a board, you know. But with you don't get that at
The
all.
scraping when you use manual,
Mm,
maybe, yeah. To be true, I never used this. Only
yeah.
if you need to do like deep pocket clean. But now I use the laser. The
No, it's
laser
very
is
comfortable.
amazing.
Yeah.
Yeah.
And you would describe yourself as a holistic dentist. I know that you use clove, for instance, instead of maybe, a different antibacterial. What other things would you say you do that categorize you as a holistic dentist?
For all these 31 years doing a dentistry, I always care about my patients, not just about their teeth, but what is behind of the oral health. Because if we don't have a good oral health, we can't have a good everything in your body is connection. Is your mouth, your stomach, your gut is as a connection. If my patient has decay, I'm going to find why, what is behind the decay, if it doesn't brush properly, what they are eating, if it has low minerals or vitamins. Having many types of vitamins, like vitamin D, can increase the calcium in your body with K2 to take this to the bones and to help your teeth as well, make it stronger. Have so many things. And I always work with the holistic approach to my patients.
I mean, this is what a lot of people don't understand, that when you have decay or bad teeth, it really reflects in your body and it can cause major problems down the line, right?
Yes.
Yeah.
It can if you keep your mouth clean and you're controlling the oral microbiome, you can prevent many diseases like Alzheimer, heart problem, cancer, many problems you can avoid to to prevent, if you start to take care your teeth and the hygiene in your mouth.
If somebody comes to you and wants a smile makeover, what's the first thing that you would look at? How would you do the consultation?
I have many cases, the patients coming to me because I do veneers and I do lumineers. Lumineers is very thin veneers. Normally, it don't need prep, don't need shave the teeth.
Okay, so is that the difference between
Yes,
lumineers and veneers?
yes. Veneers
Okay.
I need to shave a little bit. And lumineers, I say dental contact lenses because they are so thin.
Okay.
Many cases don't need prep, don't need shave at all. But some people, they are so crazy. I know I want the smile makeover. I want Hollywood smile. I just want to put veneers. I'm conservative dentist. Many cases, their teeth is perfect for the face. You know, just need put in the correct place or just brightening up with the whitening, and done. Don't need to always put veneers. I don't sell in veneers. I sell what I always care about, the health in my patients. And many cases they came to me to do veneers, and I did Invisalign, and after this whitening, and they are very happy.
What about the whitening? Because I personally always had a very yellow undertone naturally to my teeth. And I would do the whitening, but it wouldn't last very long. And my teeth were quite soft and very small for the size, like for my smile. So, what do you say about that? Is this some people that it's more susceptible to than others?
Yeah, many cases as well, adults have a small teeth. And I analyze many of these cases. The gums is cover the crown, the tooth. And this case is what I do, gum contouring,
Oh, wow.
to show the correct size of the crown of the teeth. Yeah?
Oh, wow.
And don't need to do nothing more. But some people has don't have the gum cover the teeth. And in this case, of course, you need to increase the length the teeth. Then it's only veneers or the lumineers.
I know that veneers are not the only option. What else could you do? I mean, I know I've got crowns, veneers, bridges, I've got the whole shebang in my mouth.
You're also surprised.
How long do veneers typically last for?
Good question. Some people say, oh, come to me, but I did my veneers 5 years ago. It's don't need to change veneers every 5 years or every 10 years. If the dentist did properly, if they use very high quality material, the porcelain, use correct cementation, the correct technique, you don't need to change your veneers.
Ever?
No, because my patients in Portugal have veneers and crowns for 30 years.
Wow.
Don't need to change.
And the color doesn't change?
No, doesn't change.
I mean,
if you use correct, best material, your veneers and your crowns change in 4 years, the color.
I mean, I know that in my last job that was done, I had veneers, crowns, and the bridges, and it took you, I was in the chair once for 6 hours trying to get them out of my mouth. And that was a really bad, cheap product, right? It was a lot of metal, if I remember correctly.
Yes, and I don't use metal ceramic, metal porcelain, you say, for probably more than 18 years.
It's unfortunate because I think as the patient, you're not aware of that kind of thing.
No.
And you trust the dentist to do the right job. I mean, mine were done, I think, 12 or 15 years previously. So they definitely needed redone. And I mean, you did make such a big difference to my look and my smile. And for that, honestly, I'll be eternally grateful. And I always talk about you to anybody.
Thank you.
Even when I see so many people now have had the smile makeover, and most of the time it's cheap looking, the shape of the teeth is not correct, they're far too white. I think that must be the biggest mistake, making them too white, because then they look so fake.
Yeah, this is the way, it's important. Some patients come to me because they did the veneers like 5 or 7 years ago, and they want to change because they don't see their self in that teeth, because I can see is a wrong shape, is a wrong color, and is a wrong size for the face. Then, of course, the solution is to change the veneers. But I use the laser as well to take off the veneers. I don't use a drill anymore. And this is quicker, safer for the teeth, of course, because I don't use a drill and don't, that attrition, and the lasers just break the cement and the veneer is coming out. And I do this a lot, Hindubai. because I don't know, maybe they looked for cheap version, or I can see the material is not high quality. I see the shape of the cheese is not correct, and I see that white opaque.
Oh, it's
It's like a
horrible.
piano board. It's not nice. It doesn't look natural. No one has a natural cheese with that white opaque. I do, my teeth are natural, and I do whitening only for 32 years around.
Yeah, you've got amazing teeth, and your teeth are your own.
Yes,
Correct. Yeah.
I don't have feelings. I don't-
Amazing.
yes,
Not one filling.
no,
Wow.
no.
That says a lot.
Yeah, my son doesn't have two.
Wow.
But this, is education. My
Yes.
father was a dentist. I grew up not eating sweets or candies in home. I never had fizzy drinks in my house. We had water. This is for you see, is the what we put in our mouths is very important for everything for our bodies, especially for our teeth. Yeah. And I just do whitening. And the whitening, if you do correctly in office whitening or use correct home whitening gel, not what you can buy in a pharmacy or this, I disagree. The
Because
strip is,
I believe it can be quite
yes, it's,
it burns the gums. I've had a few
yeah,
sessions with
and
dentists.
it's not good for the surface of the cheese as well. But if you use the correct gel, what I use for 32 years doesn't damage the teeth.
Amazing.
And of course, you said before when you had your natural teeth, the white didn't stay long. But then it depends what product your dentist use or which one you did in home white. But again, if you drink a lot of coffee or black tea or red wine, fried food, all this is stains inside their teeth, not only in the surface, because under
Penetrates.
penetrate in the dentin. But when I do whitening, it's like a bleaching the teeth,
Yeah.
clean the surface, but clean the under the dentin, because the dentin has tubes. It's like a tubes,
Okay.
and it's clean inside as well.
Okay.
This because this sometimes some patients has a little bit more sensitive during the whitening. It's because it's clean deeply.
Okay.
But it's give a very, very good results if the patients are happy with the teeth, and if I see don't need improve nothing, the shape is fine, the size is perfect, the position the teeth is perfect, just do whitening.
Amazing.
Yeah, and keeping this and nothing else.
What if somebody's drinking red wine and coffee and all the rest of it? What is the prevention that you can do at home? Or let's talk about home care and cleaning your teeth properly. Can we go through the steps of that?
Yes. Well, okay, yes. I always been very careful with my teeth, and of course, my patients is oral health. I always, again, I do the more holistic way. What I do for myself, and I ask for my patients to do, is do like in the morning, the first things you wake up, scrape your tongue with copper one. You scrape your tongue, you're going to take the bad bacteria from inside your mouth, because you have billions bacteria inside your mouth, around 700 types of them, good and bad. You don't want to keep all the bad ones, because the bad ones can cause damage for your teeth. First thing, scrape your tongue in the morning. Wake up, first thing, tongue scraping. Second, you can do oil pulling. Oil pulling with the organic extra virgin coconut oil. You put 1 tablespoon inside your mouth and you move around this coconut for around 15 minutes.
I'd do that, yeah. But we can start with 5, right? And then they can build it
Yes,
up. 5,
yes.
10, 15,
And
even
15,
20
even
minutes.
20 minutes. And then you floss and you brush.
All right.
You start your day with your mouth totally detox. People do a lot of detox juice, fasting, yeah? Intermittent fasting, but they forgot to do the detox, mouth detox.
And there's
Is
so much bacteria in your mouth, right? So I've learned,
billions.
yeah, I've learned something new now because I'd get up, I'd do the oil first, then the brushing, then the scraping.
No, scrape is the first
Ah,
because you need to
right,
take the watch, stay all night in the
right,
top. First you do scraping, second oil pulling, third floss, fourth brush.
right.
Then is clean. You can drink your half liter of water to all clean your system. But you drink this water with no bad bacteria. Of course, you can't take all, but big percentage you wash away. You
Amazing.
know?
Lemon water first thing in the morning.
Well, first thing in the morning is this routine, yeah? And then you need to drink your water. After, I suggest wait maybe 15, 20 minutes. You can drink warm water with lemon. Sometimes it's acid. All the acid is corrosion and can give erosion and then going to be sensitivity, even can give decays, cavities, because the surface of the tooth is not there anymore.
Right. I think that's actually what happened to me because I've been drinking lemon water in the morning for years.
You can drink sometimes. The problem is the times, like if you take it, if you can drink it sometimes and immediately just wash down with water just for the bacteria don't take this acid and create more acid in your mouth, and then the pH is changed, and of course is damaging more your teeth.
Makes sense. What about nighttime routine and all the gadgets that are on the market these days? I mean, I've got the water
Water
flosser.
flosser?
Yeah, and I've had that for years and I think that's amazing.
I like very much, especially when people has crowns or veneers or bridges or implants. I like very much. But you always need floss as well.
Yeah, you've always highlighted the flossing, the flossing, the
If you
flossing.
don't floss every day, imagine you don't clean your teeth 40%.
Wow, 40%. Okay. I'm a bit guilty actually. I
No, you
must
can't be
focus.
guilty
Yeah.
because I know what is behind your
Yeah, yeah,
crowns.
yeah. Okay, good reminder. How does dental health connect to overall beauty and wellness?
In my opinion, I always say, your health is starting your mouth. It's a connection.
Yeah,
You can't have overall health if you don't have oral health, is a big connection. And for this, I recommend this oral hygiene. And of course, every 6 months, go to the dentist to check, to do a professional clean, to check not only your teeth, but to check your gums and check your tongues, check is everything. Behind this, the quality life. Your diet is very important.
yeah. Tell us a bit about diet. What foods are good and bad? I mean, I know that I would always suffer from the lower teeth at the back. I'd get that calcium buildup. Can that also have to do with the quality of water you drink?
This is normal because it's the pH of the mouth. This is normal to make. This is a tartaro.
Tartar,
Yeah,
that's the word.
this
Yeah.
is the plaque. The plaque is created after 2 hours you eat. If you don't brush your teeth after meal, you create this plaque. This plaque is getting harder and harder, and then it's getting the tartar. Some people has more tartar than others, not because they brush less or more. It's this pH, and I believe the water can help as well. You know, too much calcium, too much chemicals in the water is not good. Try to drink mineral water because this is important to take out this starter because this has a lot of bacteria and can damage as well the teeth.
What's one memorable case that you did where there was a real before and after difference? And how did the patient react to that?
Wow, you have so many.
Big question. What's
Yeah,
the top three that stick out in your head?
yours one of them. Because
I know you told me it was one of the, she said it was one of the hardest cases she'd ever
yes.
done. I felt so bad.
No, because when I met you, I said, "Oh, you are stunning, glamorous, you know." But I want to have this comfortable way how to say to you,
No, it was Carla that
Katrina.
actually, yeah. She actually suggested, come on, let's do your teeth. I'm going to give you a smiling
Yeah,
makeover. So I absolutely jumped at the chance.
yeah.
And yeah, here we
Because
are
I see,
today.
the middle line was. I think I can correct this. I can correct. And then one day I said to you, please, let's do this because I was speaking with you, just looking for your teeth. And I can imagine, oh my God, I can do this, I can do this size, I can do that size is correct for her face.
No, and actually, a lot of people comment on my
Yeah.
smile. Even strangers will come up to me and say, "Oh, I really like your teeth." I say, "Well, go and see Dr. Carla."
And you see, it's changing you.
It has, yeah.
It's you feel
You
free
do
to
feel
smile.
confident,
Yeah.
yeah. It does bring in a lot of
Yeah,
confidence.
Katrina, for all these years in my career, and my passion is still the biggest satisfaction is to give back the self-esteem for my patients.
Yeah.
Because I have so many patients come to me and doesn't smile like this.
Yeah.
I feel I need help.
Yeah.
I need help.
I mean,
You
I
know?
was just thinking that on the show that I do here, I talk about everything aesthetics, hair, and you're like the missing piece because we haven't spoken about dentistry before. And I feel it is one of the most important things for an aesthetic look.
Totally. Have I don't know if you know, but many of plastic surgery knows this doctor in Brazil. Very, very famous, Dr. Ivo Pitangui. He died 100 years. He died. He lived for a long time, but he created many techniques, and he's from Rio de Janeiro. Very, very famous he was. He always said, all his patients come to him to do facelift or anything on the face. He sends it to dentist first.
Yeah. I would agree with
Dentist
that.
need check
Yeah.
what dentist can improve in the face because the smile is the biggest thing to show. And then he does the facial, the what he needs to do in the face, a facelift anyway. And he always said this quote. He always said is a bad teeth or missing teeth take more attention than face without wrinkles.
That's true.
I totally agree.
Totally agree. Yeah.
People are so fanatical to put a lot of Botox, a lot of fillers, or to do facelifting, but they don't go to the dentist to check if the bite is correct. If they are loose, the vertical dimension like yours, I increased your vertical dimension. The plastic surgeries can do many lifts in patients, but if the patient lost the vertical dimension by the bruxism, always going to feel strange the face.
Manual brushing versus the electric toothbrush.
Both are good if you brush properly. Always need to use soft bristle toothbrush, the head. Always soft, never medium or hard. You can brush 3, 4, 5 times a day. People say, oh my God, but you brush 5 times. No, going to ruin your teeth. No. If you brush it with a soft toothbrush.
Yeah, I mean, I knew that a long time ago. I've always done the soft.
I used many years manual ones, soft. And for around maybe 12, 13 years ago, I started using electric toothbrush. I love the one you make this round, because you just move and you feel your teeth cleaner more for a long time.
How long should you stand and clean your teeth for? 1 minute, 2 minutes?
They recommend there is 1 minute minimum.
1 minute minimum. And what's the correct way to brush? Because I know a lot of people brush too hard. They use too much pressure.
It's wrong.
I mean, I actually dated a dentist when I was in my 20s, so he taught me a lot about that. How
You
to
can't
brush
put
properly.
pressure. It's like I say, you brush your teeth. You don't going to scrub the floor. Of course, when you scrub the floor, you use hard brush, yeah? But your teeth, no, you're not going to use a hard brush to clean your car.
Yeah.
You don't. Why?
True.
Because you're going to scratch. The same our teeth. Exactly the same. Soft toothbrush is the way. And the way how to brush. The electric toothbrush, you don't have technique. You just need to move the toothbrush. Make sure go to all the surface, outside, inside, and the top of the tooth, inside the lower, inside the upper ones, The manual one has many types of techniques. You can make it round, you can make it upper and down, and upper and up, but soft toothbrush always.
Okay.
And the correct toothpaste is very important.
Well, that was my next question. Toothpaste.
Toothpaste, okay. Fluoride, without fluoride. I prefer without. Being a holistic, I prefer without.
They say fluorides blocks the third
Yeah,
eye.
it doesn't help even kids as well, make more agitated because it's toxic. We have fluoride in water, some foods and fish you eat, and I prefer without. You can use the hydroxyapatite.
I've never heard of that. Where would you get that from?
Some pharmacy has toothpaste without fluoride and has hydroxyapatite. Hydroxyapatite is going to protect the surface of your teeth, because it's the same crystals have to make the surface more strong and protect her against decay, sensitivity.
I use
It's
the
very good.
Allodent toothpaste, and it's got no fluoride
No
in
fluoride.
it. Yeah.
And it has what minerals there? Do you know?
It's got CoQ10, it's got tea tree oil, I think cloves is sometimes there.
I like essential oils. I like some holistic dentist doesn't like essential oils because they believe it kill all the bacteria like the good ones. What I study about essential oil is good for us because it's like cloves is anti-inflammatory, help to prevent like gingivitis. I like you don't need to do every day, but sometimes like you do water floss, you put 1 drops of
That's
cloves
what I
in the
do.
water
Yeah.
and the floss.
I do the tea tree or the cloves or peppermint, you once told me.
And I see the result every 6 months when you came to me.
Yeah.
The beginning, remember, had more inflammation.
Yeah.
Now don't have inflammation.
Yeah.
Because you care more about probably use your water floss, you flossing.
Yeah, it's true.
And I like very much essential oils.
What could you do at home if you don't have the money to do a smile makeover? What are the things that you could do to help your teeth look a bit better?
Katrina, I always say first thing, need to go to the dentist to check if they are healthy. Because behind this is the position they choose is perfect, the bite is perfect. Because every smile makeover I do, or every treatment I do with Invisalign, every patient sit on my chair, I check their bites.
Can we talk about Invisalign? Because some people don't know what that is.
Invisalign, I'm an orthodontist for 23 years. always have been used the brackets, you know, the
braces,
fixed,
yeah.
the brackets,
The ugly
yeah,
metal
or
braces.
porcelain one, until I needed to use it because I have one tooth is coming out with age, unfortunately. If the tooth is not correct line in the arch, they are going to be more out and out because
Protruding.
the arch shrink. I said, oh, I don't want to put brackets on myself, the metal one or the ceramic one or porcelain. And I'm going to try the Invisalign. I didn't believe really the Invisalign because I said, how this mobile orthodontic appliance is going to fix my teeth.
So it's just basically a plastic
It's a
guard
thermoplastic
that goes in.
Yes, very tight.
Yeah.
Make it for you, and you need to change every week.
Oh, wow.
Yes. What I do a scanner, 3D scanner, take the pictures, make in a computer your treatment, what we need to correct. First thing I look bite. If your bite is not correct, if you have cross bite posterior, if you have open bite anterior, if you have deep bite anterior, if you have gaps between the teeth, or if you have crowned teeth, you know, all much together, I can correct everything with Invisalign. Change every week. And it's amazing because it's aesthetic. You can speak, you can eat anything you want because you take out, you can have your meal, you can go for some event.
So you don't have to use them
you
24/7.
No, you need to use it 22 hours a day.
Okay.
Yeah.
So you can sleep with it.
Yes, minimum is 20 hours.
And for how long on average do you think somebody...
Depend of the cases. My case was 3 months.
Because it's usually a lot longer with the metal braces.
Yes, 3 to 4 months. Invisalign, what I see is reduce the time to correct the position, to push the teeth to the correct position.
Right.
For my experience, I use Invisalign now for many years. I stopped using brackets, classical orthodontic. I just use Invisalign because it's practical, it's aesthetic, it's amazing, you know? It's faster. It's faster.
Yeah, I mean, I know it's the latest thing. Mercury fillings. I mean, I'm talking like more than 25 years ago when I was dating this dentist, he removed my mercury fillings.
Very good, yes.
And replaced it with porcelain. Are there still people today that have mercury fillings?
Yes.
And if somebody came to you with mercury fillings,
yes, all the time.
What would you say?
I believe no dentist use amalgam anymore. Is the silver filling, mercury. But of course, I still see patients with the mercury fillings, and immediately I said we need to change. Because they said, but it's a long time, it's no problem. Yes, it's problem.
Mercury
because when you
poisoning.
eat, has the friction and you still is falling the mercury. And I change safely, and I put white filling, or I put inlay or onlay in porcelain. But yes, need to change because it's the mercury, and mercury is toxic. Increase the risk for dementias and many diseases.
I mean, if somebody was to come to you, what's the advice you would give them for looking for the right dentist to do their work? Because, you know, a lot of people look at price and they go by price, but I really believe you get what you pay for in anything.
In
anything.
Exactly.
And, you know, people are so focused on the price. I mean, what do you say to these people?
Don't look to the price ever. You know, it's behind a cheap price has a cheap material.
As I was to know.
You know.
I mean, the dentist I went to came highly recommended to me, and he was over in Dera in this, you know, basic clinic. And people would come from out of town to see this guy, and he was crazy. I mean, he'd wear Crocs and shorts. He was totally unorthodox. He'd smoke in the back. And I mean, he was just crazy.
Yeah.
But his prices were half of that in Jumeirah
Probably less than half.
for a reason.
Yes.
As I was to find out when I met you, you know.
Yes. I was shocked.
Yeah.
Remember.
And I mean, I've got crowns in the front, and he drilled way, way too much.
Yes.
I mean, I was traumatized.
Yes.
In the one session I had with him, it was horrible.
I remember when I took your
Yes,
crowns, and
yes.
I was shocked because in my career I never saw shaved so much the tooth, and I never will do this to my patients, you know, because save the tooth is the most important thing. Like, I'm not crazy. Like, these patients come to me to do veneers. I'm not saying, no, yeah, let's do veneers. No, I always going to speak about the health, the position the teeth. I'm going to do what I need to do to maintain the teeth if the teeth is correct for the shape, like I said to you before. But yes, you need to look always. Don't look to the price. Look for the doctor if he's a really qualified to do the job. You know, if he does courses, if he go to a congress, if he use new techniques, because it's in medicine, you need to upgrade all the time. I never stopped studying. I never stopped. And I always use the latest technique and the latest machine, you know?
Yeah, I mean, that's like you and me. You know, it's such a fast paced industry, beauty, aesthetics, it's forever changing. And you have to keep up to pace. Absolutely.
All the time,
Yeah,
you know?
yeah.
You can't stop. And you do this for treat better and better and to protect more the teeth of the patients. I try to keep the teeth. I do everything, you know, even if the tooth has like abscess or periodontal disease, if the tooth is mobbling, I do deep pocket, I do ozonotherapy.
So tell me about
Together,
ozone
this is a
therapy.
combination. Like if you do deep pocket, do you know what is this? Is the infection the root of the tooth?
Okay.
Nothing to do to the nerve inside the root, is outside the periodont. And I do a deep pocket with the laser. The laser take all the bacteria there, clean totally, but at the same time stimulate the grow a new bone. And together with combination with this treatment, I do IV ozone. And this is clean all your system with the ozone to reduce the inflammation, to reduce the infection.
Because for those that don't know, ozone therapy is oxygen,
Yeah.
and nothing can live in oxygen. Everything is killed in
Yeah.
oxygen. I mean, I've used ozone therapy on my body where they take your blood, they mix the ozone, they put the blood back in with the ozone, and that keeps your blood clean. And they say it's very beneficial for cancer patients as well.
Yeah, for many treatments.
I mean, the thing I like about you, Carla, and I think in a town where people are just after your money, you've always been very authentic, and you always try to do the minimal to get the best result. You're not there to take as much money as you can.
No. I always say I continue doing my job, you know, because the money is because I love my job, and I'm here to help, you know, and to do the best things to the smile, to give back the self-esteem, to correct the position that it is, and to correct the bite, the functionality. Yeah, because many people, I believe many dentists look for the money and look for the aesthetic only.
And then I get very cynical, and you know, you're the expert, I am not, so I have to trust what you're telling me, you know. When we get older, a lot of the time the gums shrink. Now, is there a way to prevent that? Is it inevitable? How does it affect, say, my teeth in another 10 years?
I see many people older don't have gum receiving nothing, resection, this retraction. But then I check the bite. The bite is perfect.
Okay.
How they brush, if they use a soft toothbrush, it's all together.
Right.
If you have a wrong bite, if you brush very hard your teeth, if you use a hard or medium toothbrush, this of course your gum is going down, and then nothing you can do. You can
Because I
do
know that if you
gum.
brush too hard, you can affect the gums.
Yes,
You move them up.
exactly,
Mm.
and it doesn't come back. Then you need to do gum graft.
Oh, and that can be done.
Can do.
So tell us about that.
Oh. Gum graft is take a strip from the palate and make the room under the gum to put this to make the gum cover the root of the teeth again.
Uh-huh. And then I believe that Botox can fix a gummy smile.
Gum smile, yes.
You can use Botox.
But then
for
I
that.
always, when my patient has gum smile, I check. Because many of them have a lot of gum cover the teeth. Then I do gum contouring with the laser, increase the length of the tooth, the natural tooth. Yeah, all the teeth is going to be longer. And I do a Botox. Easy, doesn't hurt nothing. It's very easy, just a little bit Botox. And when the patient continues smiling normally, but doesn't show too much the gum.
Yeah.
And just make more attractive. And just no pain at all.
Yes, I know a few people that have done it and it's really successful.
Yes, very nice.
So, have I missed anything out? Is there anything else you'd like to talk about?
When I came to Dubai, I see a lot of this, like I said to you, the white opaque smile, and now they want to change for the natural veneers. Like they say, the 3D dimension or 5D dimension veneers is because it has more natural aspect for the natural teeth. But what I say, what is behind these veneers? Are the teeth healthy? Not all smiley makeover, the teeth behind this are health, because this is important. You know where to go. The dentist you go to do your full mouth rehabilitation or your smile makeover. And you need to check this, because can have infiltration behind the veneers and between the tooth.
Yeah, you don't know that.
It's very important to check this.
What about root canals? Because people say they're very problematic and they can lead to a lot of other problems later on.
Yes, scientific, they say is some teeth is connection for some organs of your teeth. Yes, but if you do properly, the root canal is much better than leave it there with infection. Or like, for example, if you have punch your teeth, like in some accident, the teeth start becoming darker. This means the nerve is died. They don't feel nothing there in the tooth. Of course, you need to do root canal to clean the nerve, because it's necrotic. It's worse you leave the tooth dead there with the nerve inside, necrotic, then take and clean and put the correct cement there inside to seal.
So the sealing's what's important then?
Yes.
Okay,
yes,
great.
to take the infection that is.
Okay, that's great. Well, look, let's finish on 3 of your top tips to have a healthy, clean smile.
Okay, hygienic. First thing for me is the hygienic. You can't have a healthy oral if you don't clean properly. And then second thing, the diet.
Diet. Okay.
Watching what you put inside your mouth is not only what you eat, but what you drink. Fizzy drink is very bad. Alcohol is bad. Smoke
Oh
is
gosh, yeah, the
terrible,
smoking, terrible, yeah.
It's very important to see, eat more vegetables, fruits, healthy meat, no fat.
They say that apples help to clean the teeth.
Yeah, because when you bite the apple, it's help to clean, but nothing the same brush or flossing. Nothing is the same. And what I suggest now, be careful, chocolate and gummies and sweets and candies.
Chocolate.
Yes, try to avoid, because the bad
I think the
bacteria
candies are worse than the chocolate because the candy's full of sugar, right?
full of sugar. Yes, chocolate. Well, if it's above 70%,
Yeah, dark chocolate's
dark
okay.
chocolate is good. It's good because they are antioxidants as well. But milk chocolate, white chocolate is more sugar. Then it's no good. And of course, try to eat after your meal. After your lunch, eat your chocolate. Then, after half hour or 1 hour, you brush your teeth.
We didn't talk about mouthwash. Just quickly tell us about
Okay.
mouthwash.
Mouthwash. I don't use and I don't recommend. I never used because I have too much, substances there, artificial ones, and it's clean all your bacteria, bad and good ones. And you don't want this. We need to have the oral microbiome. Your oral microbiome going to protect you against another disease.
So you'd rather use tea tree, peppermint, or clove?
Or cloves, or have another essential oil as well. But if you don't have nothing, if you don't have gum disease or why use? If you do, tongue scrape is the best thing.
Tongue scraping, yeah.
It's very good. Oil pulling is amazing. It's amazing. If you use this, you don't need to use essential oil as well.
Amazing. Dr. Carla, thank you so much for giving me your time. I know you're really busy.
Thank you so
Well,
much.
there you are. We have finished another episode of Glam Up with Katrina. And I think I've come full circle talking about oral hygiene and how a smile makeover can absolutely change your life. I'm living proof. So, Carla, where can we find you?
Monday to Friday in Cornerstone Clinic at Grosvenor House Hotel in Marina.
Amazing. And your Instagram?
My Instagram is Carla.Cirino.
Amazing.
There I give a lot of advices. No, I don't like put just before and after. I like to give advices for the people following me.
Excellent. And you can get me on katrinavalenti.com and of course, Glam Up with Katrina on Instagram. So until next time, stay beautiful and thank you so much.